Baby boomers comprise about 25% of the population, but yet they actually comprise about 75% of cases of patients with hepatitis C. When we look at why that might be, we have to look back to folks who got their hepatitis C 20, 30 years ago who now are developing the complications such as cirrhosis and liver cancer, etc. The main risk factors are blood transfusion before 1992. Another main risk factor for hepatitis C is intravenous drug use or intranasal drug use. People always wonder, would it have to have been that I used intravenous drugs for years and years and years to get exposed to hepatitis C, and that's just not the case. One could have experimented one time or two times in college, and that would have been sufficient to be exposed. And then the tricky thing about hepatitis C is you don't necessarily get sick when you first get exposed, and it might be something that just gets uncovered on a simple blood test. So testing for hepatitis C is very simple, but it's one of those things that unless your doctor is aware of specific risk factors for you, he or she might not know to test you for hepatitis C. According to the CDC's recommendations from 2012, all baby boomers should be tested for hepatitis C regardless of any risk factors. Nobody is very comfortable sharing a history of former drug use if that's their particular risk factor. Even things like blood transfusion, patients may not remember to tell their new primary care physician about. Certainly it's the physician's responsibility to remember that all baby boomers ought to be tested, but patients are partners in their own health care, and it's very important that they, if they haven't been tested, request to be tested. And it's so important to identify patients who actually have hepatitis C, particularly in light of the new treatments which have become available. It would make such a difference to be able to identify someone before they develop cirrhosis from hepatitis C and to eradicate the virus completely with relatively easy treatment.